Joining us in the studio for the next hour, Corrections Secretary John Wetzel. Secretary Wetzel, we're halfway through the Corbett administration's first term. Summarize your accomplishments. How do you rate yourself, your performance?
I rate the department's performance fairly high, B-ish. You know, it's a team business. Corrections is a team business, and our administration takes that approach with everything. We came in a really challenging financial environment, but we were able to move the ball forward, I think, significantly in corrections and criminal justice in general through the governor's leadership with the Justice Reinvestment Initiative, and really started changing the focus of the criminal justice system, and especially the correction system, to be more research-based and really focused on outcomes. So in that aspect, you know, we're heading in a good direction. I wouldn't go higher than a B at this point because it's early. 2 years, but it's been 2 good, strong years. So it's a strong foundation, a strong start.
Welcome to the PCN call-in program. I'm Karina Wilson. For the next hour, Secretary Wetzel will answer your questions. Call us at 1-877-PA65001, or you can reach out to us on Twitter as well. Let's get back to a little bit. Let's talk first about the budget that was just announced last week. Your department, how did you fare?
We're budgeted for roughly a $60 million increase. And again, I think we discussed this last budget time. Every year we start our budget process with an increase of $100 million. When you look at approximately 16,000 employees, our rollover costs every year are about $100 million. So that's where we start. Last year's budget, we were able to really push the bar and have a flat budget. This year, we're going to need a increase of $60 million.
Looks like we have a call already. Corey from Jeanette, welcome to PCN.
Hi, how are you?
Very good. Go ahead, please.
Hi. My husband is a correctional officer for SCI Greensburg, and I just have some points that I'm kind of curious about. You know, years ago when they built, when they were talking about building Benner, it was made known that they were going to move the inmates from Rockview to Benner. What happened to that? Is that yes or no? Was that in the making? I mean, that's just what we've heard of. And, you know, it is an older prison, and it makes sense that it's on the same property. Why aren't they moving and doing all that instead of closing these 2 prisons that are still structurally and operate well? Why aren't they doing that?
Yeah, I think that I don't. Again, Benner was started before the Corbett administration came on board. But I think at that point, the assumption was that our population was going to continue to grow. So I think even at that point, Benner was looked at as an expansion. But as we talked about justice reinvestment briefly, when the Justice Reinvestment Bill, Senate Bill 100, passed, the fiscal note attached to that projected 1,000 inmate decrease this year. And the population has tracked with that the first 6 months since that's passed. So at that point, it became obvious that we really need to look at SCI Benner as a replacement. And then how you identify what facilities to replace, if you're trying to save money, is you look at which is the most expensive to operate. And then in the case of, you use Rockview, which is on the same grounds as SCI Benner. Rockview costs about $84 a day per inmate. Greensburg costs us closer to $110 a day per inmate. Crescent, which is the other affected facility, costs us in the low 100s. So by closing those 2 and opening Benner and keeping the capacity essentially the same, we'll save $23 million. So the reason, when I talked about $100 million rollover costs, the reason we're asking for a $60 million increase, a big piece of it is that $23 million reduction from replacing those 2 facilities with the new SCI Benner.
So let's drill down a little bit into the closing of the 2 prisons. You were in front of the House Judiciary Committee Subcommittee on Corrections, and help me out here.
Yeah, it was the Judiciary Committee, and it's a subcommittee on crime and corrections.
Today, it was on PCN, and you testified extensively there. There's been lots of coverage. Tell us a little bit about the announcements that were made 2 weeks ago and the fallout since then. Yeah,
well, we actually made the announcement in early January. We've had 2 hearings since. We had a Senate hearing roughly a week and a half or 2 weeks after the announcement. And and then we had our House Judiciary hearing today, and much of the attention is put on a couple things. Number one, the timing of the announcement, and the legislators felt like they should have got more notice for the notice. And I say notice for the notice on purpose because we gave legislators a day's notice that we were going to make the announcement in early January that by the end of June we were closing these facilities. So initially, some of the press would lead one to believe that we took the approach similar to what the Colts did when they moved out of Baltimore. Mayflower trucks showed up and trucked them over to Indianapolis. But we made the announcement 6 months out. And then the questions were about the process. And most of the questions were from the local legislators affected. And I got to say that that's what we elect our local officials to do, to fight for their areas. So I don't say that to cast aspersions. I think it's appropriate. The questions were appropriate. And the questions really focused on, are we really saving the amount of money we said we're saving? Was the process, did we really look at everything? And are we making the right decision? And to aid that, right after the announcement, we put all the information on our website. And so on the Department of Corrections website, which is www.cor.state.pa.us, every piece of data that went into the decision is on the website. From how much it costs per day to some of the attention was on how much we've spent at those existing facilities in construction costs over the past 10 years in keeping them operated. Local impact was local fiscal impact was a big. What's the economic impact going to be of closing prisons? And that's really some of the toughest parts to answer because you know globally, all four caucuses, everybody across the board has said we spend too much money in corrections. But when the rubber hits the road, to not spend as much money in corrections, there's an impact locally. So a lot of what we're hearing is that tension between wanting to globally save money in corrections so we can spend it in other areas that we want to spend it, like education, like human services and those kinds of things. And the fact that in many of our communities at prisons, our increase in incarceration over the past 20 years does have a local fiscal benefit. You know, you're talking about taking a $50 or $60 million enterprise out of a community. So both hearings were good. I think I testified about an hour at each of them. Got a lot of questions. Today in particular, Representative Krieger, who's a local rep in the Westmoreland County area, had a lot of pointed questions and appropriate questions. And again, I really appreciate the local legislators and the role they play. And I appreciate the question, and we should be able to answer the questions, which I'm confident that we have. I mean, this is, if you look at the data, this is the right thing. At the same time, it has a big impact on the communities and on the staff. And that's, you know, it's difficult when you have staff who do the job that we do in corrections, which is a dangerous job. And to make that announcement and say, you know what, you're going to have to work somewhere else other than where you've worked. And many people have moved to be in the area and those kinds of things. Just, you know, we're fortunate that the announcement isn't we're furloughing all 800 of you. The announcement is you're going to have to drive a little further in many cases. So that's the good news. But still, if you're a person who's been displaced, it's not good news. I mean, let's be honest. It's a difficult thing. And so now our focus is really putting a team together. At the governor's direction, we put a team together that included DCED, economic development folks, labor and industry, the job folks, Department of General Services, who really oversees empty buildings and is in charge of property, and our staff as rapid response teams to work with the local jurisdictions to mitigate the local economic impact. But at the same time, when we passed Senate Bill 100, this is what everybody said, we're doing this. It's a great public policy. We're going to get better outcomes in our correction system. We're going to reduce population. And so this is what reducing spending in corrections looks like.
Is there one follow-up, and then we'll go to the phones. Is there any question that this plan is a done deal, or is this still open to debate?
I think it's a done deal. From our perspective, it's certainly a done deal.
Let's take another call. Norman from Cambridge Springs, you're on the air.
Yes, thank you for taking my call. Last night on the PCN network, they had a nice fiery debate over gun control there with the two legislators there, Republican and Democrat. And there was a lot of discussion about the violence in Philadelphia and stuff. And I'm just asking you, what's your stand on gun control in Pennsylvania here?
I don't really have much of a stand on gun control. We've been a little busy with corrections. I will tell you that the violence in Philadelphia Philadelphia is the biggest driver of our population, 27%. I'm familiar with the efforts that the district attorney, Seth Williams, is doing there, specifically targeting people who use guns as it relates to bail and sentencing. And I would say that from my standpoint in corrections, people who use guns who should be in our state prisons. I think the governor has said since the mass shootings that one of the big issues is mental health. And we've certainly seen that in the Department of Corrections. We've seen an increase to where 21% of our population and 50% of our females are mentally ill, and they're coming to the criminal justice system. So really identifying those root causes and addressing and keeping people healthy out in the community, whether controlling gun control or not will have an impact. I think the key in these things is that we got to kind of remove the emotion out of it. And we really got to look at what is an effective, look at what the research says, and let's really drill down and have some honest conversations at what the root cause of it is. And then when we get to that, then we need to do the right thing. But I don't think at this point we know this, right? So I think we have one side who's saying, let's ban guns, and another side who's saying, no, let's have more guns. And, you know, I'm not sure any of them are operating off data. And I think that's really where we need to get to in criminal justice in general, but specifically with this issue.
Do you keep data on how many inmates you have in the system who used a gun in the commission of their crime?
It depends on the charge. We keep data on the charges, and sometimes the charge doesn't reflect that a gun was used, so it's not easy data for us to pull. I wish it was. I wish we could be, our data could be more part of this conversation.
Let's head back to the phones. Mark from South Park, welcome to PCN.
Yes, I would just like to commend this gentleman for the fine job he did testifying today. And I did have a comment to make, and I was hoping that he could respond to it. A fantastic job. I think that for the legislators to use the word blindsided, and I'm a Republican as well, either they didn't know it was being built or they were ignorant in the fact that it was going to be replacing another jail. I think that, you know, they were putting on a dog and pony show and trying to make you out to be the bad guy here. And what did they think? You can't build a prison in a week. What did they think they were going to use it for? A new prison. That's just my comment. I was hoping I'd get a response. Thank you.
Okay. Well, thank you. I would say that I would probably not disagree with you. Agree with you 100% in that last year this time nobody realized that we would be able to pass the legislation, you know, with the governor's leadership that we were able to pass. Okay. And the fact that we passed legislation, and you know, for years we've been passing criminal justice reform, quote unquote, it's not had an impact. So for us to pass this, it actually do what we said it's going to do, which is start reducing population. I think there was some genuine surprise that we're at a place where it makes sense to look at as a replacement. So I wouldn't say it's a complete dog and pony show. There's always, in the process that we have in America, in politics, there's always an aspect of that. But I got to be honest, the local legislators that I dealt with over this issue, they have real questions, and their constituents expect answers. So I respect that. I wouldn't accuse them 100%. Sure, there's always posturing. I mean, when you get on TV, you posture a little bit. That's how it works. But I think they have legitimate questions, and we have legitimate answers for the questions.
In the orthodoxy of, let's say, state planning for any kind of move, not just in corrections, what role does the consideration of local impact play? In other words, like what percentage of that decision should be based on the impact to the tax base and to the school enrollment and jobs and so forth?
I think if there's a disparate impact in one area over another, and it's a significant and disparate impact, I think it has to play a role. But again, I think the reality is, you look at the list we provide on our website are the facilities that cost us over $100 a day. So if you look at those, you pick an area that wouldn't have a negative impact from a $50 or $60 million enterprise being pulled out of it, and that it ends up canceling each other out.
So were those the only two facilities at which it costs you more than $100 a day per inmate?
No, there's a list on our website. It could be 8 to 10. And what we looked at is first the per diem, but then you look at what specialties they have there. Like SCI Green is one that has a higher per diem, right? It's in that list of over 100. But then you look at the function, you say, oh, you have death row there, and we have our biggest RHU. We know that costs more staff.
What's RHU?
The restricted housing unit. So we have a big disciplinary unit there. We have our capital case unit there. And we know that a capital inmate, it costs us $46,000 a year for a capital inmate. It costs us $35,000 there. We can't replace that function. So that's off the list. You look at SCI Laurel Highlands, which is our nursing home, $142 a day. So you look at that and go, why didn't you close that? Because it's a nursing home. And nursing homes mean lots of staff, lots of nursing staff. So first you look at the per diem, then you take out the specialties and you say, can we replicate the specialties? What's driving up the cost? Why is that place over $100? When you take all that stuff out, then you have a list to work from. And that's the list we work from. And then you look at other considerations also. Crescent happens to be the oldest, the closest older facility to the new facility at SCI Benner. And again, while the local staff clearly is impacted by it, when you look at we have staff all over the department. There's other places where if we were to close the facility, there would have been a lot of staff who would have had to relocate across the state or taken a furlough. So that no one of those things is the driving force, but when you put those together, these are the two that jump out at you. And when you look at closing two facilities and how you save the most money and you do that math, and I'd encourage you to go on our website and look at the per diems and do the math yourself, these are the two that jumps out.
And how long a drive is it from the facility at Crescent to the new place at Benner?
It's roughly 60 miles. This time of year with this weather, who knows? But it's roughly 60 miles. And keep in mind also that not all the employees who work at both of those places live in those places. Some would live further, some would live closer. But I think also on that website, we have a map of both facilities. We drew a 60-mile radius around both facilities. And with SCI Crescent, I believe it's 9 facilities within that 60-mile radius. With SCI Greensburg, I believe it's 5 or 6 facilities within that 60-mile radius. So we were able to, we issued a hiring freeze about a month before this was announced to free up more positions. And again, in an operation our size, we turn over between 80 and 90 positions a month. So you're talking about a significant, so that month of hiring freeze freed up more positions in the area. And so that has a benefit, and we were able to offer everybody a job, which is good. Again, we're not in a situation like you look at Illinois just made an announcement, and they're talking about laying off 400 employees. State of Washington closed facilities. They have 20% less staff now than they did in 2010. This is kind of the state of corrections in the country now. We're realizing that our practices haven't always yielded the best results, and the new practices are yielding better results and also resulting in a reduction in population. And so we're having to make these hard decisions, but you got to make them on data. One of the things that you don't want is you don't want a political process where, depending on whether your county or your jurisdiction voted Republican or Democrat, and depending on if there's an R or a D behind the person who's in the governor's position, we're making decisions on that. That's not appropriate, and that's not good government. Good government is looking at the data and making the best decision based on the data. And then, having the data, everybody can look at it and come to your own conclusions. I'm very confident that if you look at it objectively, you'll come to the same conclusion we did.
Very good. Let's head back to the phones. Anita from Jeanette, thanks for your patience.
Good evening, Secretary. My husband's a CEO at Greensburg, and I know you're very much a number man, so I want to ask you how you justify closing Greensburg. When we look back at the numbers of last year, we were like 100 and some % populated, and they moved out inmates to other places, and now we went down to 86. I mean, as a taxpayer, not a wife of an employee, it almost looks like a manipulation on the taxpayer's side. Can you please answer that?
Sure. And actually, we just posted on our website today a look at a 5-year look back at the per diem, because some of the conversation at the lady's referring to is that we reduced the population at SCI Greensburg and several other facilities. And if you remember, during last year's budget process, people said, how are you going to get a flat budget? And I said, we're going to close older, more inefficient housing units. So we did that. Greensburg had a couple older, inefficient housing units. So when you reduce the number of inmates, right, and you have so let's say Greensburg is around $45 million a year. Okay, if we have 1,000 inmates, you take that 45 million, you divide it by 1,000 inmates by 365 days, and you get your per diem. So what the lady was referring to is that we have less people. The number you divide it by is lower, and that increases the per diem cost. So we looked at a 5-year look-back window, and I'd encourage you to get on our website and look at the 5-year look-back window. And actually, this year wasn't the most expensive year. The year before we reduced that was actually more expensive at SCI Greensburg. So when you look at, if we would have looked at just one point in time, that would be a legitimate argument. But if you look at over the 5-year period, Greensburg has historically been the most expensive facility that doesn't have a specialty. So it doesn't have like a mental health unit. It doesn't have a, I mean, every place has a RHU, but it doesn't have a significant infirmary. It doesn't have those specialties like a nursing home or a mental health unit that we can't replace. So again, the numbers are not a one point in time. We're just looking at it today and we're going to make the decision. We looked over a period of time and it's consistently been up there.
One quick question before we head back to the phones. Is this proposed arrangement, do you get revenue in? In other words, are you selling these properties?
You know, I don't know. And that's what DGS and DCED, part of it is working with the local, both the local legislators and the local officials to identify what appropriate uses are. Certainly marketing the property. If you look at other big state properties, Scotland School was just sold, so that's an example. But the process to do that is not an overnight process. I'm sure it's not a surprise because nothing's an overnight process in Harrisburg.
Does that revenue get credited to your budget?
No, no.
Let's head back to the phones. Steve from Erie, thanks for your patience.
Yes, thank you for taking my call. Good evening, Secretary. It's my understanding that the state is currently taking bids to privatize the mental health services in all state institutions. My question is, why do you think that a private company can provide better mental health services to the inmates? And especially, how do you expect these contractors to work with security, especially in the RHUs or on housing units when they're not state employees? Thank you.
Okay. Yeah, thank you. We did put out a bid for mental health services. Now, keep in mind, all our mental health services now are outsourced except our psychologists and our psych assistants. So we already have it partially outsourced. But what we did is the same thing we did with the nurses. We put a bid out because the contract's up. One of the options is business as usual. So we have the psychiatrists and all the mental health staff on the mental health units privatized, and then the psychologists not privatized. Then we set an option to say our staffing pattern and you privatize, and then we'll compare the two. What we did in the case of medical, we looked at the two. Privatizing would have saved us about $5 million over 5 years, but when you weighed in the operations and the interruption operation, we thought our nurses could deliver it better, so we chose not to privatize. There's no decision that's been made, but we said from day one, when these things come up, we're going to compare apples to apples. We're going to make sure the process really looks at both. We're going to compare privatization and non-privatization. We're going to make the best choice, both financially and operationally. Because a truism in our field, like medical or mental health, is that when you have bad services, even if they're cheaper, they cost you more at the back end. And again, I'd only point to our medical process where it was a $5 million savings, but that $5 million would have paled in comparison because we get better services and don't get a lot of lawsuits from medical, knock on wood. And we thought that the quality of the services outweighed the $5 million. And so we'll go through the same process with psychiatry or psychology, and we'll see how it ends up. Have you outsourced any functions? We have not. We already have partially outsourced things. We have not done anything completely outsourced. Medical was the first contract that came up, and we looked at it. Mental health is the next contract that came up, and we're looking at that. And we said consistently and continue to say, outside of core function stuff, right? So outside of security and the day-to-day delivery of most treatment, that's core function stuff that we see our staff doing. We're going to explore privatization and see what makes sense. Let's take another call. Rob from Blairsville, welcome to PCN.
Hi, thank you. A couple questions. How many prisoners are in the county and that should be in state facilities? And my biggest current concern here is what kind of prisoners are we letting out into the population that should still be in prison? I mean, is it come to the point to where we're letting out fifth-time DUI drivers that haven't killed somebody, and then the one that has killed somebody staying in? Or do we have a magic pill that we're giving these guys that they're turning into good guys? I'd just like them couple questions answered.
Okay, I'll start with the county question. Actually, we're bringing all the inmates back from the county. As you know, the first two things we did was brought all the inmates out from out of state. Brought 1,000 back from Michigan our first year, brought 1,100 back from Michigan our first year, 1,000 back from Virginia our second year. We're moving all the inmates back from the county. We had about 600, and numbers closer to between 400 and 500 now. We're bringing them back, and one of the things that passed in Senate Bill 100 was that those beds, the county beds, were able to use for parole violators. And what we know about parole violators is that when they come back to the Department of Corrections, when they get out, they're more likely to commit another crime. So we believe, and the research would suggest, that if we keep them closer to home and keep them still plugged into their support systems, they'll be more likely to be successful, and that's what county jails are really good at. So contractually, we can't furlough any staff when we have inmates out at other places. So all of them are on the way back now. We're going to be putting parole violators in those beds. Secondly, as far as who we're letting out, we've not changed. And one of the key parts about this reform effort that's different than every other effort is that this was a bipartisan, multi-cameral, as they say, effort, and DAs were right at the table with this. The parole board, local law enforcement, they were all right at the table with this. What we did is we improved the system, focusing on outcomes, focusing on how do we better deliver services, how do we better get people prepared to be paroled, and how are we going to get more success when they get out. So we've not changed the bar at who gets out more. We've improved the system. We do a better job of delivering programs in a timely manner. The parole board is seeing more people. So we've improved the process, not changed the bar one iota. And as far as letting, the illustration, I think, probably just an extreme example the gentleman was trying to use, 5-time DUIs. I mean, in Pennsylvania, we have min-max sentences. So they're sentenced to 2 years to 5 years. When they hit 5 years, they're getting out anyhow. Okay, so we've not changed that process at all. Unlike many states, we didn't switch to a thing where we give good time. No, actually, we did the opposite. We used to allow people out before their minimum on pre-release in halfway houses. We eliminated that. So if anything, we're doing a better job of making selections at who gets out. And again, this legislation passed unanimously in both the House and the Senate. And I challenge you to find another piece of legislation that passed unanimously in both places. That's not the case at all. And that's often the argument when people don't want corrections reform to happen. Oh, they're risking public safety. Not the case at all. And as a matter of fact, New York Times just did an article on what's going on in New York City. New York City's reduced their incarceration and reduced their crime by having better practices. And that's what we're doing.
Take another call. Evie from Pittsburgh, welcome.
Yes, hi. I just started listening to the program. I just have a question. When you have inmates who are located like in Virginia, I'm from Pittsburgh, in Virginia, then you move them back up here to Pittsburgh to Crescent, and I understand you're closing Crescent. Then you move them all the way to Hotzdale, and that is a distance for parents to travel, to be seeing, their sons, and it's just a distance, and you keep changing from one prison to another, and it's hard to, like I say, myself, to travel from here to there, at least try to see your son or father for once or twice a month. It's really hard. Could you answer that for me?
Yes, ma'am.
I'm sorry, Evie.
Yes, ma'am. Thank you. Yeah, it certainly is a challenge. And one of the things in our system historically, there was a decision made in the 90s that what we're going to do is when we get someone in, we're going to send them as far away from home, and they have to earn their way back. Our administration believes the opposite. We believe we need to keep people as close to home as possible. To undo that, to turn this cruise liner, it's a process. And one of the things the process focuses on now is as someone gets closer to home, to get them closer to their home. That process will not happen overnight. The fact is we have 10,000 more beds in the West than we have inmates from the West, and vice versa in the East. So it's a process, but we're certainly working towards that. But it's just the nature of incarceration. We have a system that has 27 prisons, 25 male prisons, if you include the boot camp, and we need to maximize our bed use. So we move a lot of people around. We move 900 inmates a week throughout on the highways and byways of Pennsylvania. It's just the nature of the beast.
Very good. For our callers who are waiting to speak with Secretary Wetzel, we're going to give him a short break as we review some upcoming programming. Stay tuned at 8 o'clock tonight. We have President Pro Tempore Joe Scarnati on the issues, talking about his bill to increase funding to the Safe Schools Grant Program from $500,000 to $10 million. After that, at 9 o'clock, it's the premiere of our new series, Focus on Education. We've partnered with the Education Policy and Leadership Center for this new series, which focuses on school violence and guns this month. That is tonight at 9. Tomorrow night on Journalist Roundtable, we look ahead to the state budget hearings, which start next week Tuesday at 9:30 a.m. Guests include Matt Bellinger from WJL 8 in Lancaster, Brad Bumstead of the Pittsburgh Tribune Review, and John Misick, the new editorial page editor at the Patriot News in Harrisburg. Journalist Roundtable airs Thursday at 8. Get the latest info on our shows and share your thoughts with us online. Just like us on Facebook and follow us on Twitter. And as always, if you like what you see on PCN, thank your local cable provider. They carry us on their channel lineup as a public service. We receive no state or federal tax dollars. Let's head back to the phones. We have Clem and Delmont. Thanks for your patience.
Yes, thank you for taking my call. I understand most of these new facilities and probably even some of the older facilities have all these amenities like gymnasiums and workout rooms. I'm an 80-year-old retired Pennsylvania taxpayer, and if I want to go to a gym, I got to pay. Why do these people who are incarcerated get all these privileges? I don't understand that. I don't think they're in there to be punished for something they done. And like I say, they're actually better off than I am as far as some amenities go. Thank you very much.
All right, sir. And I hear that a lot. I would say, sir, if you walk through one of the prisons, you won't come out and say, boy, that's a place with a lot of amenities. Certainly, we do have gymnasiums and workout areas. Keep in mind that, 5,000 of the people who are with us will never get out. So that's where they live. There's an aspect of people get sent for punishment. I mean, you don't come to a state prison for jaywalking or singing out a key in church. Get that, right? But there's also an aspect where 90% of the people who come in our front door get out our back door. And so the question you got to ask yourself is, how do you want someone to come out that back door? Because ultimately, that person who comes out the back door is going to be your neighbor at some point, or your daughter's neighbor at some point. So ask yourself this question: how do you want them to come out? Do you want them to come out older and angrier, with no skills except learning how to stay alive and went through gladiator school? You want them to come out with a skill set on how to live in the community and be a productive member of society. We believe, as an administration, we believe we have a responsibility. We believe that corrections mean that we have to give people the opportunity to correct people. We're not naive enough to think that every person who comes in is going to come out and be a perfect person. There's a reason we have prisons. Some people need to be locked up forever. Some people who get out should have been locked up forever, but they haven't done anything yet bad enough to be locked up forever. The vast majority of people, if given the right circumstances and the right opportunity, have an opportunity to be successful. We have a responsibility to do that. And again, if you look at what the research says, what's effective in corrections, it's identifying the root cause of the crime, it's providing programming that addresses those root causes, but it's also creating an environment in the prison that's a normalized environment, like the community, where people can learn how to interact with other people, to live on a daily basis, and to sustain themselves. Again, I would not call it amenities. Certainly there's a gym and there's rec areas, with the equipment of which, by the way, is not paid for by tax dollars, but paid for from profits from the inmate commissary and phone system. So those things are not tax dollars, nor do we think that tax dollars should go to that stuff. But we also think that people need to learn how to recreate appropriately. I think that's an appropriate thing. And we also have to keep people productively occupied. You have 2,000 criminals in a big building, right, with a bunch less staff than that. And, idle hands are the devil's playground. So having productive activities are an important part of what we do.
Are there opportunities for Pennsylvania citizens to take tours of our correctional facilities?
Yes, they can reach out to my office. We do tours. Obviously not on a daily basis. We do have some things going on in our prisons, but certainly an opportunity at times to do tours. Yeah, they can reach out through my office. Again, you go to our website, we have a contact.
And one more follow-up. You talk about the data telling you, or the research telling you, that inmates need good, productive use of their time and so forth. Does the recidivism rates suggest that it's working?
No. No, our current recidivism rates and our research shop, Brett Buckland, Bob and Nikki just have completed a recidivism report that looks at recidivism in Pennsylvania more in depth than ever, and looks at it in 3 ways. One, every offender who got out, and this is a 3-year recidivism number, which is the measure, up to 2008, who was rearrested. Everyone who was reincarcerated, and then combine the 2 figures. So out of everyone who walked out of our door, how many were either rearrested or reincarcerated? The numbers are not good. Rearrest rate, 50%. So 50% of everyone who gets out of our back door gets rearrested. The reincarceration rate is closer to 43%. The combine of the 2, 62%. So our outcome measures are not good. But the reason we did this is to say this far and no further. The legislation we passed is Pennsylvania taking a huge step into, unfortunately, the future in criminal justice, which should be the current, which is using research-based things that we know and we can expect will reduce crime. So we wanted to draw a line and say this far and no further. That's what this report does. The report will be out in the next 2 months. So where we're at today, we're not happy with, but we're happy that we measured it, and we're happy that we draw a line to say we go down from here.
Let's take another call. Francis from Coatesville, welcome.
Yes, ma'am. My question, I have 2 questions, but my first question is, have you ever considered incorporating certified peer specialists into the treatment or the rehabilitation of your inmates? Certified peer specialists are individuals who have the live life experience, mental health issues, drug and alcohol issues, or both, and incarceration. And my second question is, what is happening to the Emeryville State Hospital property?
Okay, we'll start with the second question. I have no idea. I don't even know what property you're talking about, so that's not under my purview. The first question, certified peer specialist, just so that the viewers understand, certified peer specialist is an individual who at one point in their life has experienced mental illness, and a forensic certified peer specialist is someone who's both experienced mental illness and have been criminally involved, and now they're in recovery from mental illness, and they go and help other people. That's where certified, they go through a course. It's a civil service job. Peer specialists, they're a peer, and they help people. The Pennsylvania Department of Corrections is probably the first Department of Corrections in the country to get a grant to do, we got 100 peer specialists trained 2011. We're now expanding that program and training more. It's a very successful program. You know, it's very rare for our offenders that an essential job function is that you're criminally involved. That's right. I mean, is there a better job for our folks? But we've also noticed, especially some of our inmates who are suffering from mental illness, and again, we've seen a significant increase in the amount of mental ill offenders who come to us, end up not adjusting well, right? So as a byproduct of them not adjusting well, not taking their medication, they don't do well with others, right? So they either harm themselves or attempt to harm themselves or harm others. And then we put them in these special segregation units. What we're learning now is that utilizing these certified peer specialists in some of our segregation units to really be there for these offenders has had a positive effect. Now, it's early. We don't have measurements, and you can, I hope, tell by now that we measure everything. And we're a data-driven operation. But the early measures, just anecdotally, are that we're having less incidents where we're using peer specialists. So we're excited about it. It's interesting that a caller would bring that up, but it's becoming more and more popular as we're pushing our mental health services to more community-based.
So these certified peer specialists are actually employees of DOC?
No, they're actually inmates. These are inmates who are trained.
And do they get paid?
I mean, we pay people between 19 and 40 cents an hour. So yeah, they get paid in our inmate work program, but certainly not minimum wage, whatever that's going to be. Certainly not that bulk, but that's what we pay our inmate workers. So
and
yeah.
how many do you have system-wide?
I think we're probably approaching 150. We trained 100 the first, but obviously 10 were long-term offenders who are probably not going to get out. 90 were offenders who are going to get out. Some have gotten out. Some have gotten out and gotten employment, especially in the Philadelphia area where they're using certified peer specialists a lot. So it's actually a reentry initiative, and we're continuing to train more and more.
Take another call. Lakeisha from Philadelphia. Welcome to PCN.
Hi, yes. I just have two questions. One is I wanted to know if there's any kind of programs in the city of Philadelphia or Pennsylvania that has like programs for the innocent victim as the inmate's children, because my daughter's father has been incarcerated since she was 8, and once he was incarcerated, she just turned like for the worse. And the school just kicked her out, like didn't understand what she was going through. And it was like unfortunate because her dad, which she seen every day, was all of a sudden taken out of her life, and she see him once a year because he's so far away.
And Lakeisha, you said you had another question. Do you have another one?
Yes, because like we fought. So that was basically my main question on how do we get programs for the innocent children, which the parents are being taken away.
Yeah, thank you for that question, and that's something that we often don't think about when it comes to incarceration. And certainly, I don't want anybody to misconstrue that. People are responsible for their actions, but one of the people who are most significantly impacted are children of incarcerated parents, and you hear stories like that, and it's just heartbreaking. I mean, imagine mommy or daddy being there and then not being there. And in the case where it's mommy and daddy and the kids go into social services, the answer is yes. There's community groups in the Philadelphia area, which I believe there's a group called Amachi. There's a group called Amachi Pittsburgh.
How do you spell Amachi?
AMACHI.
We'll put that website up on our the link to their website up on ours tomorrow.
Yeah, they're a nonprofit, similar to Big Brothers and Big Sisters, but specifically target the children of incarcerated parents. There's an Amachi Pittsburgh also for the people in the Pittsburgh area who do good work. Big Brothers and Big Sisters is something we did an initiative last year where we actually Wilson Good from Philadelphia on a grant came around to all our prisons and encouraged inmates to sign up for Big Brothers and Big Sisters. Now this impacts about 60% of our inmates have children. So it's a huge issue. And the thing about it is when individuals get out and are well-adjusted and don't come back, their children see that also. So that's why when we focus on trying to correct people, there's a bigger impact. There's a butterfly effect. And the next generation is something we have to look at. And when you look at our incarceration numbers, especially in minority communities and poor communities, when you look at the incarceration numbers and look at, especially alarming to many of us, is the increase in female incarceration. Now, at the county level, many places have increased from 10% to 15%. At the state level, it's less. It's from 7% to 9%. But how many children now, especially in some of the more blighted areas, are being raised by their grandparents, by their grandma, right? Grandma's in prison now. So we really need to look at this and look at identifying root causes. We have such an opportunity. And we've spent a lot of this year focused on these closings and this and that, but what's get lost in the mix is that we have great staff in the department who really, care on a daily basis and really care about delivering good services and understand that we have a role, and our role is to impact the community in a positive way and help people reduce their likelihood to commit another crime. And when we do that well, it has a benefit not just for this generation, but for generations to come. And as a society, we really need to take a step back and say, when someone commits a crime, where are we going to get the best outcome? And then do that so we get a better outcome and be outcome focused, not revenge focused.
Let's take a call from Colonial Park. John, you're on the air.
Hi, Karina. Thanks for taking my call. Mr. Secretary, I've been trying to get the answer to this question for a long time. I talked to Ed Marsico about it, and he said I'd have to ask somebody in corrections. Do we have any private or big corporations doing any business with inmates, doing telemarketing or any kind of I see you smiling, but I really want to know because I seen a program where they had inmates called telemarketing, and they were saying, "Is mommy or daddy at home?" And some of these guys were in for life sentences, and I just want to know, in Pennsylvania, do we use private corporations, and where's the money go? Do they charge us? We charge them? What's the scoop? Thanks.
Yep, we do not do that in Pennsylvania. There are states that do it. I'm smiling because that absolutely happens. What that requires, and that's an extreme example, in most cases, places that, states that use their inmate labor in private and partner with private industry don't do telemarketing and that kind of stuff. That certainly, as a father of 4 daughters, gives me as much heartburn as it gives the caller, clearly. We don't do that in Pennsylvania, nor will we. But there are other opportunities for public-private partnerships as it relates to inmate labor that other states do under what's it called, prison industries. And we do prison industries, but none of that external private partnership stuff.
Take another call. Ann from Williamsport, welcome.
Yes, I'd like to know when smoking is going to be banned from state corrections. We understand the hazards of smoking and the cost it is to corrections. That's my question.
Okay, we do have a couple non-smoking facilities. The field is slowly evolving to that. It's not going to be an overnight thing. As someone who's worked in corrections for a long time and responsible for a lot of individuals who are locked up, it gives me a little heartburn to think of an entire system of 51,000 inmates all doing smoking cessation at the same time. Causes me a little stress and heartburn, but we are working in that direction. Most county jails are non-smoking. It came out of a lot of secondhand smoke lawsuits. Some of our newer prisons, we started them out non-smoking. We're slowly working in that direction. It's a long process. But to the caller's point, it's a legitimate point. The negative aspects on health, and when we're paying the price for that, their medical care, it's a pretty compelling argument. But again, we still have a lot of smokers and all quitting at once. This is not something I'm interested in doing today.
Are there rules about when and where they can smoke, if they can?
Yes. Yeah, certainly they can
cells?
smoke outside. They're not supposed to smoke in their cells. I said not to supposed to smoke in their cells because clearly, just like in high school, people sneak in to smoke in the bathroom. We certainly have some of that, and that's where we get a lot of pushback from the non-smoking inmates. So that's why it makes sense, and I'm sure eventually our system will evolve to a completely non-smoking system, but I don't see that happening anytime soon, quite frankly.
Head back to the phones. John from Bath, welcome. John, are you there? I think we've lost John. One last try. John.
Yes.
Oh, I was too quick. I am so sorry. John, if you're still watching, please call back. I am so sorry. That was my quick finger there. Next call. Meg from Easton, welcome.
Hi.
Go ahead, Meg. Meg, are you there?
Yes.
Okay, go ahead,
yes.
please.
Okay. Hi. Can you hear me?
Yes.
Okay. My question is, yes, can you hear me?
Yes, I can.
Okay. Unfortunately,
Meg, if you turn your TV off, that will help you hear us.
oh, okay, great.
Okay.
1 second, please.
Sure.
Okay. Okay, great. Okay. My question is, unfortunately, it's come to my attention that obviously prisons do not have a very successful rate. And the reason that people seem to be going back to prison is because when they get out of prison, if they have a felony record, they're denied basic human rights, such as food stamps.
You still there?
Yes, they are denied basic human rights like food stamps, employment, etc. And many of these guys have no other option than to go back to prison. So I'm wondering if there's legislation in place in Pennsylvania that can override some of the obstacles that are disabling these, in particular, young minorities from getting jobs when they get out of prison.
Okay, thank you. We kind of call that collateral consequences of crime. Just to clarify a couple points. First of all, people who come out of prison are not deprived the right to get food stamps. That's not, certainly while you're under our purview, even if you're in community corrections, you're not eligible for food stamps, nor should you be. But they're not deprived of basic rights. Fortunately, in Pennsylvania, a state, as soon as you get out, you're eligible to vote. So we're not a state that some states you have to be out for a period of time, and Pennsylvania's not a state like that. However, that's not to say that there's not obstacles when one gets out for staying out. But I often hear, they had no choice but to turn back to a life of crime. I disagree with that. I mean, when you look at reincarceration rate, right? 43% of everybody who gets out ends up getting reincarcerated. That means 57% don't, who have the same barriers and obstacles standing in their way also. So at some point, certainly there's collateral consequences and there's jobs you can't have. And you could make the argument we've overdefined the amount of jobs an offender can't have when they get out. And I know there's some areas, Philadelphia in particular, that have really pushing this, check the box. And having people have the background checks on the back end after you've interviewed somebody, as opposed to on the front end by just looking at a piece of paper and those kinds of things. And I think those efforts are important. I think it's a legitimate consideration to say at least interview the individual. Right. And then if their crime is of a certain nature, and again, we're not talking about sex offenders working at daycare. Obviously, nobody wants that. And there's a group of crimes who we shouldn't be working in certain areas. But you can make the argument that we've overdefined that. By the same token, 50% of the people find a way around it. And a lot of it comes down to, at the end of the day, you have to look at yourself in the mirror and decide that you want to be a productive citizen, and you're going to hear no 99 times, but then ask 100. And that's something that people have a responsibility to do.
Take another call. Maria from Clearfield. Go ahead, please.
Yes, hi. So, I just had a quick question. Just ever since that the pre-release program has been terminated for all the state inmates, what other programs are you looking to institute in order to give these inmates maybe some good time or some type of look forward before their minimum, or are you just looking to have state inmates pretty much just serve their minimum sentence before they get out?
Yeah, and what the lady's referring to is our pre-release program was the program where people who get out up to a year before their minimum date and go out to a halfway house. As an administration, we believe in truth in sentencing. We believe that if as a victim of a crime, you hear that the offender or the person who victimized you get a 3 to 6 year sentence, that doesn't mean in 2 years this person can be in a halfway house basically back in the community. They should do that 3 years. Now, what we're doing to offset that is we're creating transition housing units at every state prison. So we'll move individuals closer to home, to the prison closest to their home, and I'll put an asterisk on it because we have so many inmates from Philadelphia. We can't move them all to Graterford and Chester. But we'll move them to the facility closest to their home, to these transition units that focus specifically on the barriers that will keep them out. So when people first come in, we assess them, we identify the root causes of crime. Generally, it's drug and alcohol, criminal thinking. We give them programming for that. But then we'll move them to the transition unit and really focus on job skills, job retention, making sure they have an ID, all those things. So we do have a plan in place for that. In particular, SCI Phoenix, which is the replacement we're building for Graterford, has a female housing unit on the grounds. Certainly not within the same fence as the male unit, as the male prison, but it's specifically for females transitioning back to the Philadelphia area. And when you think about where our female prisons are, Muncie, Williamsport is the closest female prison to Philadelphia, in spite of the fact that nearly a third of our inmates are from Philadelphia. So moving them closer to home as they get closer to getting out, and doing it in an environment that we can increase visits and those kinds of things, really speak to what the lady was talking about and preparing people to be successful when they get out. We're absolutely committed to that. We don't think people getting out early accomplishes that.
Let's take another call. James from Reading, welcome.
Hello. My question is regarding domestic relations between county and state. What I don't understand is people that get locked up for domestic relations in the county, as soon as you're incarcerated, the money starts to add up. If an inmate does 3 months or 6 months, already he's 6 months in the hole without any kind of work because he's incarcerated. Inmates that go to state jail, basically, it's a big difference between county and state. Do you think there'll be any kind of changes in the future for that?
Yeah, and let me clarify a second. If someone comes in for not paying their child support, which is what the gentleman was referring to, I believe, he said domestic relations, right? Yeah. First of all, that's a civil charge. They can't come to a state prison for that. So they don't come to a state prison for that. There are counties that do some creative things with putting people right on work release, putting them in a day reporting center so they can keep working if they're working. Generally, if someone gets to the point where they're locked up, it's because they're either not working or they're working under the table and not paying. But it varies county by county, like most things in Pennsylvania.
We have 2 minutes left. Do you want to take one more call?
Sure.
Karen from Coatesville, you have the last call.
I have the last call.
Mm-hmm. Go ahead, please.
I'm ready?
Yep, we're ready.
You're closing prisons. I want to know if Lancaster County Prison will be one of those prisons you'll be closing because of how old it is. It has... I
think we may have lost her. Lancaster.
Okay. It's important to understand that the county jails, or some places called county prisons, are operated county by county, not under the purview of the state or the State Department of Corrections. So we wouldn't have a decision in that. We're really focused on our 27 state prisons. So we don't really have a dog in that fight.
Well, we have 1 minute left and no calls, so I'll ask you my question, which is up until tonight, every time you've been on, we have calls about pay compression. Line employees making more than their managers. Tonight we have none. Something change?
Yeah, actually it did. Last year's budget, we were able to address about 2/3 of our managers with a pay compression fix, especially the managers who oversaw officers where the biggest compression was. So we made some progress in that in spite of being able to have a flat budget. And happy to start taking a step, and I know the administration is committed to do that. We know that government, is as good as the staff we have working for it, and especially the managers. We certainly appreciate it as an administration.
Very good. We're out of time. Corrections Secretary John Wetzel, thank you very much for being with us tonight.
Always a pleasure.
Remember to stay with us for the President Pro Tempore of the Senate, Joe Scarnati, talking about his proposed increase to the School Safety Grant Program. Then at 9 o'clock tonight, it's the premiere of Focus on Education, a new series on PCN. And a reminder, if you didn't get a chance to call in and comment during tonight's show, you can continue the conversation on our website at pcntv.com. I'm Corinna Wilson, and for everyone here at PCN, thanks for watching.